Welcome everyone. My name is Dave Dresner. I am the Executive Director for the Freedom Center. We are the Center for Independent Living that serves Frederick and Carroll counties. If you don't know what a Center for Independent Living is, it's going to be hard to give you a little elevator speech, but Centers for Independent Living are organizations that are run for and by persons with disabilities to serve persons with disabilities. Our services are almost always absolutely free, and there's never a charge to reach out and talk to us and see if there's something that we can help you with. So whether that's advocacy or some information or a referral somewhere, or whether that's services that we actually do ourselves that we can help you with. There's 7 centers altogether in Maryland, covering the entirety of the state. So no matter where you are located, there's a center in your area. And if you happen to call a center that doesn't serve your area, we will happily connect you to the one that does. So don't be afraid, reach out to us, talk to us, email us, go to our websites, go to our Facebook pages, all of that good stuff. So I want to welcome you to Independence Amplified Maryland. This is a weekly live stream that is brought to you by this Maryland Centers for Independent Living. And it's really to inform and empower the disability community and further our message of independence and self-direction. I am independent, I am strong, I am in charge, I am prepared. So this program is being recorded. It takes sometimes up to a week to get those recordings onto the YouTube page. I believe that's the YouTube page of the Image Center. And we can send you information for that, or you can go to their website and find where it is. I want to thank everybody for being here. I want to remind you to register and continue to come. We're trying every week to bring people and speakers to really inform and educate all of us together and our supporters. And we do like this program to be interactive. So we do take questions, we try to answer those questions, but the caveat being everyone's muted at the beginning. Please put your questions and comments into the chat box or raise your hand, and we will try to get to you. The host will try to get to you. Luckily, I just have to do the intro and then I'm going to be done. Making sure I didn't miss anything critical. And I think that probably is close enough to what I needed to say. So we have a great live stream for you today. I'm going to actually turn it over to Sarah Basart. She is the Executive Director for Independence Now. Take it away, Sarah.
Thanks. Thanks. Welcome, everybody. It's so good to see so many people on here today. I have a great opportunity to introduce Maureen Van Stone, and I'm going to read just a couple sentences about her in a second, but we had a great conversation last week and totally changed the topic of what we were thinking we were going to advertise, and I think this is actually even better because it's going to give people a lot of information about ways in which you can take action if you feel you are a person with a disability who's been discriminated against. And originally we were just going to focus in healthcare, which we'll do as well. Maureen's going to do both, but we have the chance to use a broader lens and get you information on more things. We sent everyone 2 documents when you registered and then resent them again this morning. So just in case you didn't hear us chatting about that while we were waiting to get started, I wanted to make sure you know that. Maureen will be referencing those documents while she's talking, so you're welcome to pull them up on your own screen or print them out and look at them, whatever you choose to do. We will not put them on this screen because accessibility wise it's sort of challenging for everyone to be able to read. And just one more reminder, Dave mentioned, putting questions in the chat box. I'll be monitoring that and raising your hand. Do give me a minute if you've raised your hand. We'll let Maureen talk for a while and then she'll indicate when she's ready for questions. You're welcome to put your questions in the chat as we move through her speaking, but then I'll try to find a good time, a break to ask questions. If you are newer to Zoom, at the top right, you have the option to hit speaker view. If you prefer to see just the person speaking, maybe it's, a little visually overwhelming to see all these lovely faces on the screen. And so if you hit speaker view, it'll just show you the person who's speaking and a couple other people, including yourself, along the side. So you may prefer to do that. And all right, so I'm going to go ahead and introduce Maureen and then let her get started. I just want to note that I have had the pleasure of introducing a lawyer 2 weeks in a row. I'm not really sure what that means about who I'm bringing to this show, but I'm happy. So I get to bring lots of expertise here. So let me introduce Maureen. Maureen Van Stone is the director of the Maryland Center for Developmental Disabilities, Maryland's University Center for Excellence in Developmental Disabilities Education, Research, and Service. She is also the founding director of Project HEAL, which stands for Health, Education, Advocacy, and Law, which is a comprehensive medical legal partnership providing advocacy and civil legal services to Kennedy Krieger patients and their families. Maureen is an associate in the Department of Mental Health in the Johns Hopkins Bloomberg School of Public Health. All right, so we're gonna kick things over to Maureen, and anything else I forgot, Maureen? Are you good to go?
I'm good. Thank you, Sarah. Good afternoon, everyone. Thank you for joining this Zoom this afternoon. I appreciate your interest in the topic of disability discrimination. I just want to give you a little bit more background. I have been a practicing attorney in the state of Maryland for the last 15 years. Prior to law school, I worked as a clinician at Kennedy Krieger Institute on our neurobehavioral inpatient unit, providing clinical care for children and adolescents with significant problem behavior and intellectual and developmental disabilities. I earned my undergraduate and my graduate degrees in psychology and developmental psychology with a concentration on childhood disorders, and then went to law school specifically for a program that offered a Center for Children's Legal Rights. And then in 2005, I came back to Kennedy Krieger Institute in Baltimore to begin a medical legal partnership to provide, as mentioned, advocacy and civil legal services to our patients and their families. I served as for 10 years as the Associate Director of the Maryland Center for Developmental Disabilities, primarily engaging in all of our policy and legislative advocacy at the state and national levels. And then about a year and a half ago, I became our center's director, and have grown the program fairly significantly in just a year and a half. And one of the recent grant awards that we received is going to be part of the focus of our discussion this afternoon. So the Administration on Community Living had a funding announcement last summer to create an opportunity for a consortium of USEDs and other national organizations to come together. And so the University of Cincinnati's USED is the lead principal investigator for the creation of something called the Center for Dignity in Healthcare for People with Disabilities. And you did receive the flyer, which is blue and white, and that has the center's name at the top, and it reads Safeguard Against Disability Discrimination During COVID-19. And I just wanted to take a few minutes to educate you all about the center and the work that we're doing at the national level. As I mentioned, the University of Cincinnati, USED, is the lead principal investigator in this work. And then we have partnered with 4 additional USEDs, including mine, the Maryland Center for Developmental Disabilities, the USED at Kentucky, the USED at Vanderbilt, and the Boggs Center in New Jersey. Additionally, there are 3 national organizations a part of the center, and they include the American Academies of Developmental Medicine and Dentistry, Family Voices, and the Autism Self-Advocacy Network. This virtual Center for Dignity in Healthcare for People with Disabilities began on September 30th of 2019 and is a 3-year funded project. And coincidentally, with the launch of the center, in the fall, we never anticipated that the COVID-19 pandemic would happen and what the implications of that pandemic would be on our work of the center. So I appreciate the opportunity, Sarah, to share this information with you all. And I want to just give you some details about what the work of the center is, and specifically the role that I'm playing for Maryland. So the center itself, as I mentioned, is a virtual center. We are working on launching a website. And Sarah, I will certainly share that information with you so you can send it out to all the participants on this meeting. And there are 4 subcommittee focus areas, I would say. The first is prenatal diagnostics and care. The second is mental health treatment and suicide prevention, specifically in the population of individuals with intellectual and developmental disabilities, organ transplantation, and end-of-life care. So the work of the center can be divided into those 4 subcategories. With the grant funding that came to Maryland, I hired a part-time staff attorney to work under my supervision. Her name is Tracy Waller, and our role is really doing the gap analysis for state laws, regulations, policies, and procedures. And specifically what we're doing is analyzing variances in potential discrimination against people with disabilities in state laws, policies, and procedures. And so Tracy and I are working hand in hand to do this analysis and to share it with our colleagues across the country who are engaging in this work. Tracy is serving on all 4 subcommittees for the center, specifically so that we can be knowledgeable about all of the laws and regulations that affect each of those 4 subcomponents that we're focusing on. And so I would say it was probably mid to late March, the Administration on Community Living contacted our center and asked if we could develop some fact sheets that could be disseminated widely across the country so that folks really had access to information about disability discrimination during COVID-19. And so my colleague Tracy and I did the legal research and worked with our colleagues in the center to create the first fact sheet that you have, the blue one that I mentioned. And the goals of creating this fact sheet were really to put it in plain language so that individuals with disabilities could really understand what we're talking about when we're speaking about disability discrimination, specifically during COVID-19. And so essentially there's, a call to action, think about equitable care and what sort of steps each person can take in terms of thinking about themselves and their access to care. And so the first fact sheet is saying basically you need to inform key medical personnel that people with disabilities have equal rights to COVID-19 testing and treatment. And as some of you may know, there were questions around the country about a reluctance of many people with disabilities to come forward and to request the testing for fear of discrimination on the basis of disability. People need to know that we need to make equitable decisions to ensure that the allocation of COVID-19 resources, supplies, and care are not based on inaccurate assumptions about life with a disability. And then, of course, the need for accommodations and making sure that all individuals can access the COVID-19 testing and treatment. And this requires accommodations that may be behavioral, may be based on intellectual or physical disabilities that may impact someone's ability to comply during testing and treatment. And then we really wanted to jump into what we're considering best practices in working with an individual with a disability, talking directly to the person, communicating as efficiently and effectively as you can, asking permission before speaking with their caregivers. So if an individual with a disability was being treated at an emergency room or at a healthcare facility, ensuring their confidentiality is protected. Asking a caregiver for assistance if there seems to be a communication barrier between the provider and the person with disability. Of course, using plain language, and I know all of you are really aware of the emphasis at the national level on plain language and making sure that documents are accessible to the readers, and making sure that the way that we're communicating is communicating risks and benefits in a way that is accessible. And keeping in mind that while the healthcare provider may have difficulty understanding the patient, generally the patient is going to be able to understand the healthcare provider if they're using plain language. And then accommodations in terms of allowing a caregiver to provide support for healthcare decision-making and treatment when needed, providing accessibility through ramps and treatment rooms that are accessible and can accommodate the use of a wheelchair, providing qualified interpreter services, and this is critically important. And using prompts or picture cues if an individual has limited verbal communication, and providing time for individuals to speak, respond, and understand what the healthcare provider is sharing. So in terms of that document, I wanted to pause now and see if anyone had a specific question about the Center for Dignity in Healthcare's Safeguards Against Disability Discrimination. And I think you could ask your question out loud. I'd be happy to respond, or you can enter it in the Zoom group chat.
Let's see, Lori Elenoff has her hand up. Heather, if you could unmute her.
There she is.
Go ahead, Lori.
Hi. Very, very interesting. Thank you for your work. Now, who exactly is getting these safeguard forms?
So excellent question, Laurie, thank you. And I will encourage everyone that I believe you all have access to the digital flyers that I'm going to be talking about today. And I encourage you, please share these with your networks. We really want to ensure that everyone understands their rights. And particularly when I go into this document that I created for Maryland, I strongly encourage you to share it with all of your networks. So these documents live on all 8 of the center partners' websites, as well as at Kennedy Krieger Institute. It is living on our main Kennedy Krieger site, and it has been disseminated to all of the Association of University Center on Disabilities network. So all 67 University Centers for Excellence around the country have received it. We shared it with all the LEND directors across the country and all the research directors across the country. So it has been spread widely, but if you know individuals that could benefit from the flyers, I encourage you to please go ahead and share it.
Great, thank you.
Of course.
There's a couple other questions here, and I'm gonna take 1 second for a note. If you sign in and you don't have your name in the box, there's 3 little dots in the upper right hand corner when you put your cursor over the box of you, and it is really helpful if you put your name in, because if it allows you to rename by clicking that blue box with the 3 dots. Otherwise it's tricky because I'm just getting things like iPhone as opposed to someone's name, so it makes it harder for me to clarify questions or be able to call on you to raise your hand. So I'll just ask folks to please use it like you'd use a name tag. It helps us to keep things straight during the call. But I do have one here where someone is asking if the sites, I'm assuming they're meaning the testing sites, are now available for people with disabilities, and is there a list of those?
So testing sites for COVID-19 testing?
I'm assuming that's what, yes.
Yeah, there is a list on the Maryland Department of Health's website, and they have been really outstanding about updating their site every day. I think in the beginning of COVID, I would get an email alert daily when their updates had been added to the site. So I would encourage you to go to the Maryland Department of Health's website, and you should be able to identify the testing sites there.
And as far as we know, all of those sites, although you have to be able to get there transportation-wise, which is something the SILs have talked about, all of those sites would be accessible to people, right?
Correct, yes.
Okay, and then there's a question, should this, and this is Lisa, I'm assuming that she's talking about the document in general. Should this information be common knowledge in long-term care facilities, the documents that you sent to everyone?
It should be. I do know that there had been some issues in some facilities early on in the pandemic. I think most of you probably know that jointly the Maryland Department of Health and the Maryland Department of Disabilities did issue guidance to all hospitals. They issued the guidance in early May and gave all hospitals, Maryland hospitals, an opportunity to review and revise their policies, particularly as it relates to visitors. That was a big issue in several states about the limiting visitors for people with disabilities. And so Secretary Neal and Beatty issued a joint guidance to the hospitals, gave them this opportunity to review and revise policies, and then asked them to allow people with disabilities to have access to caregivers and direct support professionals and others while they were accessing care. So if you have not yet seen that guidance, and I want to be clear, it is guidance to hospitals. It's not a law. It is not a regulation. It is not an executive order. But the language is available. It's on MDOD's website. So if you haven't seen it, go to MDOD's website and you can access what was provided to all of the hospitals and see the exact language that the secretaries are encouraging hospitals to use.
And someone's just made known here in the chat that if you, this is a statement, not a question,
Okay.
if you're living in a DDA provider-owned home, that there is a mechanism for you to get testing at home and not to have to go out to a testing site. So that was good information. And the provider is able to obtain a test from the health department and bring it to you.
Great. Thank you.
Thank you. I believe that's, let me just double check the hands raised. I think we've got everything for now.
Okay, excellent. And so once the Center for Dignity and Healthcare for People with Disabilities published our original handout, there was still a lot of questions that were coming up across the state of Maryland. There were complaints filed across the country from individuals with disabilities. There were complaints filed from protection and advocacy organizations with the Office of Civil Rights. And so my staff attorney and I decided to go a little deeper and do a deep dive into looking at the types of discrimination and discrimination remedies that are available. And so while the first fact sheet, I think, provides some good information, the second fact sheet, which is a publication, a digital flyer, published by the Maryland Center for Developmental Disabilities, we do a much deeper dive, and that is the green document that you received. I do want to note that I will walk you through this document and try to answer any questions that you have. We did put a disclaimer on the fact sheet indicating that many Maryland state and federal courts are closed during this time, and I wanted folks to understand that because what we're doing through this fact sheet is giving access to resources to file complaints, but we wanted folks to be aware that the courts had been closed during most of this pandemic. So the first issue we tackled on the fact sheet was discrimination on the basis of disability, and that's what we saw occurring in other parts of the country. As I mentioned, there were a number of complaints filed with the Office of Civil Rights. Those complaints can be filed online or in writing. And essentially the complaints are being filed because the complainants allege that Section 504 of the Rehabilitation Act of 1973 was being violated. And the Rehab Act of 1973 is a basic federal law that protects individuals from disabilities, protects individuals from discrimination on the basis of disability. And so 504 applies to entities that receive federal financial assistance from any federal department or agency. And under the law, individuals with disabilities may not be excluded from or denied the opportunity to receive benefits and services from certain programs. And these entities include many hospitals, nursing homes, mental health centers, and human service programs. And so because there was a series of complaints that were filed in March, on March 28th, actually, the Office of Civil Rights issued a press release that was announcing some flexibilities on civil rights laws and HIPAA that are going to apply during the pandemic. And I encourage you, if you've not taken a look at that guidance from OCR, my digital flyer links directly to it. So you can just tap on that link and you will be able to see it. The second issue we tackled was workplace discrimination. And that is filing a complaint with the Equal Employment Opportunity Commission. And workplace discrimination occurs when an employee or other entity covered by the Americans with Disabilities Act, commonly known as the ADA, treats a qualified individual with a disability who is an employee or applicant for employment unfavorably because the individual has a disability. Disability discrimination can also occur when a covered employee or other entity treats an applicant or employee less favorably because the applicant has a history of a disability. And then the third way of filing a complaint for discrimination on the basis of disability is filing an ADA complaint with the Civil Rights Division of the U.S. Department of Justice. And you can allege disability discrimination against a state or a local government or a public accommodation, such as a private business, such as a restaurant, a doctor's office, retail store, or hotel, just to name a few examples. And then the other way that someone can be discriminated against is in employment, housing, public accommodations, or state contracts. And in those circumstances, you can file a complaint with your state office of the Attorney General. And so I will say this is the only place where we did not put the link on there because we did want this to be disseminated widely. And so we didn't want to link just to the Maryland Attorney General's website. We wanted this to have a broader reach. So if anyone has any difficulties accessing the Attorney General's website and where to file the complaint, you can certainly reach out to me. And then, as many of you know, all states and U.S. territories have a protection and advocacy system. And in our protection and advocacy system in Maryland, it is named Disability Rights Maryland. And some of you may be familiar with Disability Rights Maryland because I believe they presented last week to you all. So Disability Rights Maryland has a team of nearly 30 lawyers, advocates, and paralegals who work to protect the rights of individuals with disabilities across the lifespan and across our state. And Disability Rights Maryland has a variety of units within their organization, including an education unit, an adult unit for people with intellectual and developmental disabilities, a housing unit, a voter rights, a mental health unit. So if you aren't familiar with Disability Rights Maryland, it's a wonderful organization, and I very much enjoy working with my colleagues at Disability Rights Maryland. On our fact sheet, we link to the larger network, the National Disability Rights Network, which lists all the protection and advocacy organizations for every state and territory. Additionally, if you're looking to hire an attorney, there is a Disability Rights Bar Association, or DRBA, and it's an online network of attorneys who specialize in disability civil rights laws and can file complaints in state or federal courts. In terms of a healthcare facility grievance process, all healthcare facilities do have a grievance process. You can file a complaint with the Centers for Medicare and Medicaid Service, or CMS. Healthcare facilities are required to have grievance processes under the patient's rights section of the conditions of participation for both Medicare and Medicaid. These rights include participation in one's own treatment, the right to privacy, the right to be free from restraint and seclusion, and the right to safety, to name a few. And then lastly, and this is one that we included because we were hearing about this at the national level, that there was discriminatory denial of care in the emergency rooms and potential violation of the Emergency Medical Treatment and Labor Act. So if there is a discriminatory denial of care in the ER, there may be a METALA violation. Again, that's the Emergency Medical Treatment and Labor Act. Both CMS and the Office of the Inspector General have an administration enforcement power with regard to these violations, and individuals can file complaints online through the OIG hotline or contact CMS and select the state of Maryland and then select the tab that reads complaints about my care or services. And so what we were hearing was that many individuals with disabilities across the country early on in the pandemic had fear of going to the emergency room, and that they were not being tested, and some were staying in their homes and remaining ill and not being identified as potentially testing positive for COVID. And so we wanted folks to understand that they did have rights associated with accessing care in the emergency rooms across the country. So this document is a deeper dive into the types of discrimination and discrimination remedies that exist. This is what we call a digital flyer. It does live on our website. We will update this flyer as needed moving forward. We have designated an opportunity to continue to update this as we sort of come out of the COVID-19 pandemic and look at other public health pandemics or health crises that occur. So I encourage you to continually share this with your network and to access our website, the MCEDS website, and you can see any updated versions of this digital flyer as we continue to monitor this pandemic and any other public health crises that may occur. So I'm going to pause now and see if there are questions about our digital flyer.
So we're just, give us 1 second. We're gonna unmute Michelle Lindsay, who has a question.
Great, thank you.
Hang on 1 second, Michelle. Heather will unmute you in 1 second.
I am unmuting her, but if she muted herself, I can't unmute her.
Okay, Michelle, hang on, Michelle. We can see your lips moving, but we can't hear you. You have to unmute yourself too. How are you? This is my friend, Michelle. Okay. There we go, perfect.
Yes, I'm not sure if this question is really directed to what is being said now, but my question is, I'm visually impaired. I just finished school. I have a career now as a nursing assistant. I'm seeking employment now. Thank you. I'm seeking employment now. I was wondering, when would be the right time to tell an employee that I have a disability? Because I figure when they find out, they might not want to employ me. How do I go about doing something like that?
It's a good question for a lawyer.
Yeah, it is a good question. So this is an issue that comes up quite frequently, and we sort of couch it in the description of disclosure versus non-disclosure. And there are lots of articles written on this topic, and it really depends on your individual preference regarding disclosure. And there are issues associated with whether or not individuals want to disclose, for example, if there is a hidden disability. There's much debate about the risk or benefits of disclosure for hidden disabilities. For physical disabilities and other types of disabilities, there's less debate on this issue of disclosure versus non-disclosure. But if you remember in the second green box on my flyer, I do address this issue, that folks cannot discriminate on the basis of disability in their hiring practices or of their treatment of the employee once hired. So while that is the law, as we were sort of discussing earlier, laws and regulations can be broken, and you do have protections if they are broken. But I think it's up to you as an individual to determine when you choose to disclose, if at all, in the hiring process. But again, the other issue is if
Okay, thank you.
accommodations of any sort in the workplace, then you need to be able to document why you need those accommodations, and you will need to disclose. So those are factors to keep in mind, because you can't ask for an accommodation without a justification for that accommodation from an employer. So that's something to think about.
Okay, thank you so much.
Of course.
Do we have other questions? Oh, sorry. I see Lori Elenoff has her hand raised.
Now,
Thank you.
I'm asking this question as a person with a disability. I received a phone call the other day from someone who said they mentioned my insurance. I said, well, what insurance are you talking about? Medicare? Oh yeah, Medicare. Anyway, they were asking me about my pains, my this, my that, and they said, well, do you want us to send you such and such? And one of the things sounded like a possible thing, and they said, well, we need your doctor's phone number. And then I got off the phone and I said, was that a scam? I mean, you know, I don't know if it's a company that then I just, you know, have you heard anything about this? Maybe I'm getting talked to.
I have not, but I would caution against you sharing any protected health information with anyone that's calling that you do not know. And you should really keep all of that information confidential. I think there is a lot of predatory behavior that's happening across the country right now with a lot of vulnerable populations. And so I really would counsel you against disclosing protected health information with someone that you don't know who's reaching out to you by phone.
Well, it's too late now. He said he's going to call my doctor, and I'm wondering if I should call my doctor. I don't know. You know, it sounds
Your doctor will not disclose, I'm sure.
okay. Crazy.
Yeah, I'm sorry that.
Lori, it's Katie. Just real quick, and maybe everyone else would benefit from this as well. I know that when I've had calls like that in the past, I've said something like, can you please provide it to me in writing? Can you send me something in the mail? And that way you know what you're getting is real.
Yeah.
Absolutely. Excellent advice.
Yeah, thank you.
I also wanted to make folks aware, if you're not, the Maryland Center for Developmental Disabilities has a very unique program called the Resource Finder. And the Resource Finder is, it's a physical space within our outpatient center at Kennedy Krieger in our 801 North Broadway outpatient building. It is staffed by an amazing resource coordinator, Jenny Jones. We have a phone line, we have an in-person space, and we also have an email address where you can write to Jenny and ask any questions about any resources that you have, and you will get a response from a person. And we look at local, state, national, and international resources. We categorize all of our resources by topic area. So there's no question that you can't ask. So if anyone ever has a question, one concern that we have right now is that our inquiries, is what we call them, have been down since the COVID-19 pandemic began in mid-March. And we're really concerned that folks don't have more questions and don't need more access to resources. And so if you do have any questions or need access to resources or know folks who do, I strongly encourage you to go on our website and to submit any inquiry that you have. And I want to ensure you that Jenny will respond to you timely. And she can, if she doesn't know a resource that exists, she will work very hard to try to find one. So I just wanted to mention that to all of you as well.
Just a couple things from the chat box. Another person encouraging everyone to be wary of any unsolicited calls, emails, and mail. I know at the Centers for Independent Living, we're always posting information about that, encouraging you to contact the Consumer Protection Bureau, if you're really not sure, and that you shouldn't, just be very careful not to give any information over the phone, because there are a lot of concerning things happening out there. And it seems like it gets worse whenever there's drama in the country, right?
Yeah.
So then Heather posted the website to link to MCDD's website, the link to get to MCDD's website, so that if you're wanting to access that from, you can go right into the chat box there and click it, or copy the link and save it for later, so you can read about some of the things Maureen has shared, or access some of their other resources on that page. Couple more questions here, and another comment from another peer saying that if about sharing about your disability at work, that if you might want to think about if it highly affects your job or not in your performance, as to whether it's something you want to disclose, that you may want to think that through. So Michelle, that was just another bit of advice from a peer over there in the chat box. So in regards to the resource finder that you just mentioned, Maureen, can anyone call that number?
Yes.
I guess somebody maybe thought that you had to be a Kennedy Krieger patient.
No, so I do want to take a moment quickly just to distinguish. So as I was talking about in the beginning, my medical legal partnership, Project HEAL at Kennedy Krieger, we only represent children with disabilities who are patients at Kennedy Krieger. However, if someone calls and they need advice, a referral, a resource, you do not have to be a patient at Kennedy Krieger to access Project HEAL for those types of services. But you do have to be a patient if you are actually retaining one of my attorneys and they're representing you. In terms of the resource finder, which is another of the MCEDS programs, anyone can contact the resource finder. You can be a provider, you can be an adult with a disability, you can be a family member of someone with a disability. Anybody can access the resource finder. And I should mention, all of the services of the resource finder are completely free. We do not charge for any services. This is a program that is funded by my center and by the Institute.
I think sort of a follow-up question on that. Do those tend to be for the resource finder, the free, free guide? Is that tend to be more resources in the intellectual developmental disability community, or is it broader than that?
It's broader, so mental health, the whole gamut. And she does everything. I mean, housing resources, she does employment resources. I mean, the whole 9 yards.
And then Lisa's asking, how about if you are an adult in outpatient in this spine rehab program? I'm assuming she means through Kennedy Krieger for the partnership services.
So, so primarily, I think what she's asking about is to access legal services if you're an adult in the spine rehab program. And primarily, our attorneys are handling cases involving children with disabilities who have special education disputes against their local educational agency across the state. So I have 2 full-time attorneys that work with me who primarily handle the special education cases. If it's an adult case, you can certainly call and we will direct you to an appropriate attorney. We have 4 law firm partners that work with Project HEAL. And then, as I mentioned, we work very closely with Disability Rights Maryland. We have a reciprocal referral process for Disability Rights Maryland, and we have other information and resources that we can provide to our adults who are being treated here at Kennedy. So I encourage you to call. We don't necessarily represent you in those civil legal cases, but we will connect you to an appropriate attorney referral. So thank you for the question.
And Heather's posted, she's so good. Heather's posted the phone number to FCT in the chat box, 443-923-9555, in case you're wanting to give them a call, and then their email as well, mcdd@kennedykrieger.org. And they're both there in the chat box.
Excellent. Thank you so much.
I think I've gotten all the questions. Oh, I have to go back. Yep, there's no more hands raised or questions in the box. Have we covered everything? Anybody else? I appreciate this, Maureen. That document, when I looked at it as we were talking last week, it's one of the most comprehensive documents that references where you go for any discriminatory practice. I very much appreciate having it. I think it's a good tool to give to people when they're experiencing something, and good tool for our staff, to have as a quick reference guide to making sure we're sending people to the right place when we get phone calls about discrimination, or when we're supporting someone at a Center for Independent Living. But certainly it's, a good document to share among the community.
Thank you. And I also just wanted to mention for folks, we have been hosting some webinars, particularly around what's happening with COVID-19 and the school closures. We hosted one for our faculty, staff, and trainees a couple weeks ago, and then we hosted one for our patients and any patients, family members, or community members. And what we are doing in those webinars is really going through the guidance we received from the U.S. Department of Education and the State Department of Ed, Division of Early Intervention Special Education Services. And we've distilled all of those documents and created a webinar that highlights all of the technical assistance and guidance we've received. It's 60 minutes. It's on our website. Anybody can watch it if you want. It was recorded. And then as the state is releasing additional documents, which we expect about 3 more to come out within the next few weeks, we will continue to update that webinar. So if you know of children with disabilities and family members who are struggling during the COVID-19 pandemic with the continuity of learning plans or distance learning, I encourage you to have them listen to our webinar and access all of those resources. So just a plug for some additional information that's out there.
Thanks so much. And one of my staff's asking for the documents. Don't worry, Rochelle, I'll forward you everything. We'll make sure they get out there. If there's nothing further, then we'll say thank you so much to Maureen, and I'll let Dave sort of have our closing words here.
Great. Thank you so much for having me.
Hi, everyone. Thank you, Maureen. We really appreciate it. It was great information.
All right,
I feel like I need to go back through the chat box and capture all of the good stuff that was there. I want to thank everybody for
all right.
for being here today.
Hang on one second.
And being on the
Dave, I think we have someone trying to ask a question. I just want to.
Oh, okay.
1 second. Ryan, were you trying to ask a question? And maybe we missed you.
Movements. Hi, I'm new. I was wondering, how do you get connected with the disability rights from Maryland?
Where do you live, Ryan? Just tell me the county, and then I'm going to get you connected to your local Center for Independent Living.
Prince George's County, but
one of my staff is on here, so
I was also, because I heard they're talking about educational stuff, because I'm also trying to attend college, because I'm only 19, so I'm also trying to attend college. So I was just wondering about that. So if you could give me some more information, I would greatly appreciate it.
Ryan, are you able to type your phone number in the chat box to me privately so that we're not handing it out to the whole world? Unless you're looking for new friends, then that's okay. Uh-oh.
I can also respond to Ryan's question as well. Ryan, on the MCED's website, okay. I do have a...
Okay, hold on just 1 second.
Okay, whenever you can type it in is fine. In the meantime, we'll let Maureen answer. I just want to send it to Sarah so we don't send it to everyone.
Okay, great. Thanks.
Go ahead, Maureen.
I just wanted to mention for folks, the MCED has a Life After High School brochure for transition planning for people with disabilities. And so that is on my website, and we cover lots of topics, Ryan, that may be useful for you in terms of accessing accommodations through the Disability Support Service offices of the local colleges and universities. We go through lots of issues, the transition from being entitled under the Individuals with Disabilities Education Act to eligibility for adult services and supports. And so I strongly encourage you to take a look at that document. And if you have questions after you've reviewed the document, feel free to reach out to me.
Okay, Dave, I think you're okay. I think he's typing.
I'm sorry, could you repeat some of that? Because
we'll get you the doc. We can send Ryan the document.
Perfect. Yeah, that would be great.
Rochelle's on, so we'll get in touch.
Okay.
And Dave, before Dave gets started, I just wanted to mention.
okay, thank you.
I don't think it's on the list, but if anyone has announcements that you'd like to make about activities that your organization is engaging in, things that you think are important to your community, we want to give you a little bit of time here at the end to be able to do that.
Sarah, did you want to talk about did you want to talk about the event that we're just putting together, the panel and online demonstration?
I think, well, do you think we'll have more information next week
Okay.
with the dates and things?
Okay.
Okay. All right. Now
Okay.
David.
Any other announcements?
Well, tomorrow is are the 2 public hearings for the state plan for independent living. One at 10 a.m. or one at 10 a.m.
Mm-hmm.
and one at 6 p.m. I'm guessing I can put information in the chat box with a link to the flyer for that in case anyone's interested. We're just trying to get input from people with disabilities and community members about what kinds of things should go in that plan that's submitted to the federal government and then kind of directs the work of Centers for Independent Living and our state-wide Independent Living Council in Maryland.
Okay, I'm not doing very well hosting. Dave, we're not quite.
Yeah, I'm not doing so great with that either.
Forgive me. I think I should have had some training. First thing is, as Mike's always much better at this, I do want to recognize that we have 2 of our elected officials on the call today. Delegate Guyton and Delegate Belcastro have both been on the whole call, so we certainly want to give them a second if they would like to make any announcements on here. And then, sorry, I guess, oh, Delegate Guyton, you have your hand raised, so Heather can unmute you. Forgive me.
Thank you. Thank you so much. I really enjoy these meetings on Mondays. I haven't been able to attend all of them, but I've learned a lot from the ones that I have been able to listen in on. I did want to let everyone know that this Thursday, the 25th at 6 p.m., I'm actually hosting a town hall and briefing on educational equity during COVID. And we're going to have State Superintendent, Assistant Superintendent for Special Education, Marcella Franskowski, on the call. We're also going to have Leslie Margolis from Maryland Disability Rights on the call, and a few other special guests, including, I'm in Baltimore County, so including some Baltimore County officials. So we would love anyone who's interested to be a part of that. You can find that information on my Facebook or my website. It's just my name and you'll find me. And we would love to have you ask your questions. We'd like to gather them ahead of time if we can and be a part of that conversation. So, you know, I draw from these groups as well, but I would love to hear it directly from you. Thank you.
Awesome. Thank you so much. Delegate Belcastro, did you?
Yes. Hi, everyone. Thank you, as always, for putting these together. I really enjoy being on these each Monday. I am currently serving on the Oversight Committee for Quality Care in Nursing Homes and Assisted Living Facilities, and more specifically, the Legislative Subcommittee. The Legislative Subcommittee met for the first time last week, and it was really just an organizational meeting talk about the topic and make those our priority as we move into our next legislative session. So we are still getting organized. If you have ideas, if you have things that are really important to you, please feel free to reach out, and I would love to put that forward and see if it's something that the committee would like to take up. We do have our next, while the subcommittee meetings are not open to the public, the full committee meetings are open to the public, and the next one is going to be on the 25th at 1:30. So yeah, please feel free to reach out anytime, and thank you again for putting these calls together.
Yeah, hang on. I got a quick question for you.
Great.
And I should know the answer, but don't. Are we tracking in the state of Maryland COVID, people testing positive for COVID or people dying from COVID in assisted living facilities as a specific category, as opposed to, I know we track nursing homes, but are we tracking ALFs?
So that did something related. I can go back in my notes, Mike, and then we can connect. That topic did come up in our subcommittee meeting. And I just don't remember exactly. I think it was I need to get back. I will connect with you. Let me look back and then I'll reach back out to you. Yeah, sorry, I don't have the answer right off the top of my head, but I know something related to that did come up in the meeting.
That's all right. The fact that you don't have the answer makes me feel better that I don't. Thanks very much.
Yeah, no problem.
Sure.
There's also been some action here in the chat box about People on the Go of Maryland, just reminding folks that People on the Go is the statewide self-advocacy organization for people with intellectual developmental disabilities. So Maureen has posted some information here on connecting with that group should you be interested, and Ken Capone is the staff director. I worked with that group for about 10 years, so it's always good to make sure People on the Go gets mentioned and thought of. Okay, I think officially it's time for Dave, unless there are other announcements that have not been brought forward.
Okay, hearing none. But I do want to point out how important not only the speakers are to this process, but also the discussion during it and the announcements afterwards. It's an incredibly good information. It's important to get that out there. I do also want to, this is my shameless plug, but this is a free service that costs money to us to put on. And we don't have grant funding for it. We're doing this because we know how important it is. When you go to register for next week's live stream, sorry, lost my train of thought there. When you go to register, on that registration page is a place where you can actually make a donation. That donation goes to help us make sure that this show can continue. So if you value what we're doing, if you value this information, and you can afford to help us keep it going, that would be greatly appreciated. Next week, if I can find where I put it, if I can find, there we go. Next week, we'll have Richard Allen on. He is the Director of Equal Opportunity and ADA Coordinator for the Department of Natural Resources. So I think that will be a really good and informative discussion, especially as we get farther into the summer months for those of you who have school-age children and are trying to figure out things to do and opportunities that are out there that are opening up that are accessible to all. So I'm hoping that that's going to be a really good and informative discussion. So we hope that you're here for that next week. And I think with that, I'm going to say thank you all again very, very much. We greatly appreciate all of your participation and all the great information that comes not just from the speakers, but from you, the audience, who come and participate each week with us. It's always informative. So thank you all very, very much.
Thank you, everybody. Have a good week.
Thank you. Thanks, Maureen.
Thank you for having me.
Thank you for coming.
Thanks to Dave and Sarah and everybody, and Maureen. Thank you so much. It was an excellent presentation.
Thank you.
Thanks, everyone.